Adrenocorticotropic hormone, ACTH. In the world of medicine, hormones play a crucial role in maintaining the delicate balance of our bodily functions. One such hormone that often goes unnoticed but is of immense importance is adrenocorticotropic hormone, or ACTH for short. What are adrenocorticotropic hormone, ACTH? Adrenocorticotropic hormone, or ACTH, is a vital substance produced by the pituitary gland, a tiny gland located at the base of the brain. ACTH's primary role is to regulate the production and release of another hormone called cortisol, which is produced by the adrenal glands, situated on top of your kidneys. Why adrenocorticotropic hormone, ACTH? The intricate web of hormones in our body serves various functions, but ACTH's main job is to help the body respond to stress. When we encounter a stressful situation, whether it's a physical threat or emotional stress, the pituitary gland releases ACTH into the bloodstream. ACTH then signals the adrenal glands to produce and release cortisol. Cortisol is often referred to as the stress hormone because it helps the body cope with stress by increasing energy production and regulating various bodily functions, including blood pressure and immune responses. Without ACTH to stimulate cortisol production, our bodies would struggle to handle stressful situations effectively. Common adrenocorticotropic hormone, ACTH, tests. The most common test related to ACTH is the ACTH stimulation test. This test is often ordered by doctors to assess the function of the adrenal glands and to diagnose or monitor certain medical conditions. Interpreting adrenocorticotropic hormone, ACTH, results. Interpreting the results of an ACTH test can provide valuable insights into a patient's health. The test measures the levels of ACTH in the blood before and after the administration of synthetic ACTH. Here's what the results scan indicate. Normal ACTH response. In a healthy individual, the ACTH stimulation test should result in a significant increase in cortisol levels after synthetic ACTH is administered. This suggests that the adrenal glands are functioning properly. Abnormal ACTH response. If cortisol levels fail to rise significantly after synthetic ACTH administration, it may indicate a problem with the adrenal glands or pituitary gland. This abnormal response could be due to conditions such as Addison's disease, Cushing's syndrome, or pituitary tumors. How the test is conducted. The ACTH stimulation test is relatively straightforward and safe. Here's what you can expect during the test. Preparation. Before the test, your healthcare provider may ask you to fast for a few hours. It's essential to follow any pre-test instructions provided. Blood sample. A baseline blood sample will be taken to measure your ACTH and cortisol levels. Synthetic ACTH administration. After the initial blood sample, you will receive an injection of synthetic ACTH, typically through an intravenous, line. Additional blood samples. Blood samples will be taken at specific intervals after the synthetic ACTH injection, usually at 30 minutes and 60 minutes. Results. The healthcare provider will compare the cortisol levels in your blood samples to determine how well your adrenal glands respond to the synthetic ACTH. For whom is this test for and what diseases does it test for? The ACTH stimulation test is a valuable diagnostic tool for a range of medical conditions. It is typically recommended for individuals who exhibit symptoms or risk factors for diseases related to adrenal gland function or pituitary gland abnormalities. Here are some scenarios in which this test may be used. Addison's disease. This rare condition occurs when the adrenal glands don't produce enough cortisol and aldosterone. An ACTH test can confirm the diagnosis by showing a lack of cortisol response. Cushing's syndrome. This condition results from an excess of cortisol production. The ACTH test can help identify the source of excessive cortisol, whether it's due to a pituitary tumor, Cushing's disease, or another cause. Adrenal insufficiency. People with adrenal insufficiency may have symptoms such as fatigue, weakness, and weight loss. The ACTH test can reveal if the adrenal glands are functioning inadequately. Pituitary tumors. In cases where pituitary tumors are suspected, the ACTH test can help diagnose conditions like Cushing's disease or pituitary adenomas. Monitoring treatment. For individuals with known adrenal or pituitary disorders, periodic ACTH tests can help monitor the effectiveness of treatment and disease management. Conclusion. While the intricacies of hormones like ACTH may seem daunting, the ACTH stimulation test offers a simple yet powerful way to assess the health of our adrenal and pituitary glands. By understanding what ACTH is, why it matters, and how this test works, individuals and healthcare providers can collaborate to diagnose and manage a variety of medical conditions, ensuring our bodies continue to function at their best, even in the face of stress and adversity. Regular checkups and proper diagnosis are essential for maintaining good health, and the ACTH test is a valuable tool in this regard. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.